And we're live. I'm Dr. Jordana, CEO and founder of EVS Pet Urgent Care. We'll start again. I'm Dr. Jordana, CEO and founder of EVS Pet Urgent Care. I'm so excited today to be joined by Adriana, as well as Jane, two of our summer students here at EVS Pet Urgent Care. I want to talk a little bit before we get into these guys' experience about why mentorship and this student program is so important. When I was thinking about it, there's kind of a catch-22 going on right now. Veterinary schools are requiring an immense amount of experience, but very few veterinary clinics allow students to come in and get that experience. The same thing happens when we're trying to hire, whether it's veterinary technicians, veterinary assistants, receptionists, or even veterinarians. We want them to come in completely trained, ready to know what to do on day one, but very few clinics are willing to take the time and give them that training. So I'm so excited to share these two fabulous women today, and we'll just dive right into it. Please, Adriana, if you can introduce yourself, tell us where you are in school, we'll go from there.
Hi everyone, I'm Adriana Miriam. I am an incoming senior at Baylor University in Texas. I'm studying health science studies on the pre-vet track, and I'm currently applying to vet school right now.
Could we please talk about your soccer situation? She is a star soccer player and is on television, okay? So
yeah, I also play on the Baylor women's soccer team, so yeah.
Amazing, so incredible. Also, before we move on, this is your third summer with EVS.
Yes.
So we'll dive into that a little bit more, but she is a repeat offender, so to speak. We're so excited to have you here.
Yes, thank you for having me.
Jane?
Hi there everyone, my name is Jane. I'm also an incoming senior at the University of Minnesota in Crookston, which is about 4 hours north of the Twin Cities. And then I'm double majoring in animal science and equine science on the pre-vet track. Also applying to vet school right now.
Amazing. So when you guys came into EVS and had this, idea, I want to go to vet school, any misconceptions that you had before starting? Anything that you kind of got into EVS and you're like, whoa, that is not what I thought it was going to be?
I would say just like I've had multiple pets like throughout my life, mainly dogs. So I was always on this side of the world, and it was just like crazy seeing what happens, what goes on in the back, and it's really just like a lot of fun, honestly. Like I thought it would be all work and everything, but I've actually gotten a lot of good like experiences with my coworkers, and like we've had honestly so much fun. Like I love coming here. So
I have to just say, when Adriana came, I want to say it was the beginning of last summer, I was on the phone with an important call, and all of a sudden one of our technicians starts screaming, and I thought something happened, and it was Adriana walking in for the first time, and they were just so excited to be reunited, and that like filled my heart so much. So that was incredible.
And then I would say this is one of my few experience working in small animal. I've mostly done large animal, and I would just say it's so different, and I love that I get to work with cats and dogs so much, and everything is so different, and it's so nice to just learn something new in such a welcoming environment.
Probably a lot of smaller tools.
Yes, exactly. The patients are a lot easier to hold rather than like a horse or a cow, so it's a bit of an adjustment, but it's been really fun.
All right, well, you guys have been shadowing around. We've had quite a few cases each day. Is there a case that kind of stands out to you, something memorable, something that had an impact on you?
I was going to say there was this one cat that came in, and it came in because it had been vomiting and things just weren't right. And then so one of the doctors did some treatment, gave some fluids, all of that. And then it actually came back the next day because something just wasn't right. It still wasn't doing great. And then it ended up having pancreatitis. But it was just so interesting seeing the process from day one, saying like, okay, this cat's been vomiting, things aren't right, doing fluids, everything like that. And then for it to come back and then get that diagnosis was just a really interesting process, and I liked being part of all of it.
I love that you guys are able to be in the exam room with us and
Yes.
really hear that feedback from clients,
Yeah.
because when you're in veterinary school, you get to do everything, right? Like, you're doing blood work and x-rays and ultrasound and a urinalysis on every single patient. And that's not the reality a lot of times. People will come in and maybe they decline those, or maybe they can't afford them on that day, or whatever that situation is. And it's amazing to be able to say, like, all right, this is what you see today, and how are we going to treat this today, and how does it look when they come back the following day? So being able to follow that is really incredible.
Yes.
Yeah. I think for me, this one was last summer. It wasn't really an interesting case. I think it was just like something very like basic, like diarrhea and vomiting, but we had a 200-pound mastiff come in, and it was just so funny to like see literally all the workers had to come in here and like try to like hold him down, because it was just like something we hadn't seen before. I hadn't seen it before, a dog that huge. So it was just great to see like the cooperation that occurs here, and like that is like the veterinary world. Like, you have to work with others and be willing to be a team player. So I really remember that moment, because it was hard work, but like we all had fun doing it. So,
And very close and personal.
yes,
too.
oh my gosh, yeah.
We're really like up in each
I
other's
remember,
space.
yeah, I was the one taking the temperature. There was like 2 people holding it, and I was just like on the floor, and I was like, oh my goodness. And he started growling, and I was like, everyone, let's go. And it was just very memorable.
That's when those large animal skills are.
Yeah, exactly, yeah. Totally what helped.
Perfect. How can students make the most out of these shadowing experiences?
I think it's so important to just ask like a million questions, or even just like and observing everything, listening closely to what the clients are saying and how the doctors speak with the clients, and how differently maybe the doctors are communicating with this patient versus this patient, and just asking questions about why do you think it's this, or why are we doing this blood work and not this blood work, or why is an x-ray best choice, and everything like that, because that's how you learn so much, is just by asking.
Yeah, I totally agree with Jane, like, just asking all the questions, and then also, like, something that I found super helpful is just having, like, a little journal and being able to, like, write everything down and, like, get definitions of stuff, because the, like, pharmacy part of it is, like, it's a little scary when you get to it, because it's so many, like, different names, and, like, you don't know what it is, so that definitely has helped me, like, realize what's what, and, like, where it is on the shelf and all that, and then also just, like, being a team player and, like, doing the dirty work, basically, like, the laundry, the cleaning of the rooms. I will say the cleaning is my favorite part. I don't know why, but I just love it, but being able to, like, contribute in, like, a way that, like, people don't really see.
There's no shortage of cleaning
Yeah.
at a veterinary hospital. And I think that is something from like the employer side too, having individuals like yourselves that just come in and it's like you've been here the whole time.
Yeah.
I mean, Jane, what is this, like maybe your 4th shift on?
Yeah, no, I've been here for like a week now.
and I just feel like she's always been here, and that is so important too. I feel like a lot of us going into the vet med don't necessarily have the personality of we're just going to be super bubbly and dive right into it. But once we get to know each other a little bit, we really are with each other, right? And that that's the kind of environment that I definitely thrive in, and I love that you guys have just dove right in, and it just feels like we've been besties forever. So I love that. Your experiences at EVS, has it changed your perception of vet med? Has it made you more excited? Has it affirmed that this is what you want to do? Or are you kind of questioning some of those decisions now?
I think for me, it's definitely made my passion to want to be a vet definitely stronger. Just being in this setting and getting to talk, or just be in the room with the doctor and doing the blood work and seeing all that done, it just like makes you want to be a vet. And I'm so excited to go to vet school, and this whole process, it's so exciting. Like, it's something new and it's something to look forward to. I'm so excited.
Yeah. A little background about me. When I first applied to college, I was actually a pre-PT major. In high school, I thought that's what I wanted to do, being an athlete and like being around that all the time. I thought that's what I wanted to do, and that's why, one of the reasons why I chose Baylor as well, because they have a great health program overall, but very good PT program as well. But then last summer, I came to EVS because I was also in between doing pre-PT and pre-vet. So last summer I was like, let me just come in and see what the vet world's about. And literally the first day, it just like reaffirmed, like, yeah, this is what I want to do. And then I've been here ever since. Like, literally every single day on my like breaks, I'm here because I just like absolutely love the vet world, and like I'm just super excited to go to school and like learn even more.
Love it. All right, any other advice that you have for people who maybe don't live near an EVS? Of course, if you live near EVS, contact us. We'd love to host you. But if you don't live near an EVS, what do you suggest for people who want to get their foot in the door?
I think the best thing is just ask everyone you know, like even if it's asking family members, hey, what vet do you go to for your dog? And maybe you can go with them to an appointment and ask the doctor, are you looking for anyone or people to shadow or things like that. Even like I did this last summer, it's just like cold calling clinics and being like, hey, I'm a pre-vet student, I would love to come and shadow. And sometimes they're willing to help you, or sometimes they'll give you another vet that does shadowing. So I think just asking everyone and just seeing if you can get your foot in the door that way.
Yeah, I would totally agree. And just like on top of that, just like not being scared to call, not being scared of the rejection, because like people are going to reject you. Like not everyone is like in a place to like have interns or have shadowers. Just like calling everyone you can, and like hopefully someone will reach out to you, but also like not being discouraged when like it's not possible. But yeah, just like for me, like I saw EVS and I just reached out right away with like no fear, because I was like, it's kind of what you have to do for vet school, just because like there's so many hours required when you're applying, but also just like me as a person, like I love this field, so I just wanted to like be immersed in it.
Yeah, I love that you get to see it from like all the different perspectives, right? Because you're not just shadowing the veterinarians, right? You're actually able to go in with the technicians and the assistants and understand what it means to take a really thorough history and why that's so important, right? Because clients, you know, will sometimes come in thinking for sure that it's one problem,
Right.
and by all means, it's something wildly different.
Yeah.
So being able to go through that whole experience, similar to what you saw the other day with the kitty with pancreatitis,
Yes.
allows you to be a part of that whole cycle of service. All right, one word that describes your experience at EVS.
I would say welcoming.
That's a good one. I would also just say fun. I know it's cliche, but I have so much fun every day. I look forward to coming here, so.
Well, thank you guys so much for your time, not only for the Facebook Live, but also being with us at EVS. You potentiate us as well, because when you've been in the field for decades, like myself, it's really awesome to see people that are coming in energized and excited. And honestly, this is our responsibility as veterinarians to be able to give back, to be able to see the potential in young individuals that are just at the beginning of their career and show them that the veterinary profession, while currently being defined with some pretty negative things, it doesn't have to be that way. We can take ownership of this profession. We can decide what the narrative is. We can put fun back into vet med. We can put work-life balance into vet med. We can put that diagnostic tools to work and continue to satisfy our curiosity as scientists, as doctors. Hope you've enjoyed this. If you have any additional questions, please feel free to reach out at any time. We'll have the links below for our email addresses, and we thank you so very much.